Hi, everyone. Welcome. Good to see you all. All right, we'll go ahead and get started here in just a moment, just making sure you all know that we're recording this session. So, good day and a warm welcome to each of you. Thank you for joining the Vanderbilt University School of Nursing Global Collaborative Series. This is a platform dedicated to exploring the diverse landscape of advanced nursing care around the world. My name is April Kapu. I'm the Associate Dean for Strategic Partnerships and Global Affairs here at Vanderbilt, and I will be moderating today's session. Please let me take a moment to thank Megan Allen and Betsy Usher, and to all of our colleagues and coworkers who have worked so hard to develop and implement this program. The purpose of this series goes beyond borders. It's a journey to learn, to understand, and to foster connections that may lead to meaningful collaborations in the realms of advanced nursing practice, education, and regulation around the world. This series serves as an open invitation to communicate, share experiences, and collectively contribute to the enhancement of advanced nursing care on a global scale. As we embark upon this journey together, we'll be using Zoom format, and I kindly request that you keep your microphones on mute during the initial presentation to ensure a smooth experience for everyone. But rest assured, there will be an opportunity for us to engage with questions and comments once the presentation concludes. And now, without further ado, please let me introduce our esteemed speaker. Dr. Selena A. Gillis is a clinical associate professor and associate dean of the undergraduate program at New York University Roy Myers College of Nursing. She is an affiliate faculty member of the Hartford Institute for Geriatric Nursing, where she serves as co-director of the HIGN Scholars Program. She is an affiliate associate professor at Howard University College of Nursing and Allied Health Sciences and volunteer associate professor for the State University of Haiti. Dr. Gillis is a certified clinical nurse educator and also certified in critical care nursing. She has been an adult nurse practitioner specializing in neuro pain management and global public health. Dr. Gillis is known for creating and implementing non-traditional immersive teaching learning innovations to address nationally identified nursing education issues that will enhance student learning and program outcomes. Her contributions have helped enhance the nursing curriculum, filling identified gaps, and answering the new essentials call for all entry-level professional nurses to have knowledge and proficiencies to practice across a variety of settings in the spheres of wellness and disease prevention and chronic disease management. Dr. Gillis is the program director of the Greater New York City Black Nurses Association Opioid Overdose Prevention Program. She has a strong community ties and advocates and has a great passion for global health, currently working with organizations aimed to serve the underprivileged and underserved communities in Haiti, Ghana, and Nigeria. She has been on 7 medical missions. She has served in several leadership and professional roles and has received numerous awards and honors for her work. Dr. Gillis is a fellow of the New York Academy of Medicine, a fellow of the American Academy of Nursing, a fellow of the Academy of Nursing Education, and just this year, fellow for the American Association of Nurse Practitioners. Please join me in welcoming global expert, Dr. Selena Gillis.
Thank you so much, April, for having me. I'm excited to talk to you all today about my work in Nigeria. As April mentioned, I am an adult nurse practitioner. I have had the pleasure of doing a lot of global work, something that I'm extremely passionate about. I have been on 7 medical missions, so 2 in Nigeria, 3 in Ghana, and 2 in Haiti, where I'm from. And so I'm really passionate about this work. Actually, my very first experience as a nurse practitioner was on my very first medical mission, which took place in Haiti in 2010 after the earthquake. So since then, I've really fallen in love with global work and try to do as much of it as possible. In terms of my other global experience, as April mentioned, I am a volunteer associate professor for the State University of Haiti, and really fortunate to be able to introduce other colleagues, especially fellow members of the Greater New York City Black Nurses Association, to teaching virtually for students, master students in Haiti. I'm also a board of trustees member for CGFNS, which is a global organization that certifies foreign trained healthcare professionals. And most recently, I became a Fulbright specialist. So I'm really excited about all of the global work to come. When I meet people, a lot of the time they always ask me, how do you do it all? How do you sleep? And one of the things that's important for me is that I do not say yes to anything that doesn't bring me joy. So it doesn't feel like work. And really, if I could, I would make my life about global work and doing global missions. But unfortunately, that can be very costly and doesn't necessarily pay the bills. So I try to give back as much as possible. So people always ask, why do you even care about what's going on in another country? Why do you work so hard to bring healthcare to other countries? And this is the way that I put it. If your neighbor's house is on fire, whether they live next door, across the street, down the block, around the corner, or in the next neighborhood, some way, somehow, that is going to have an impact on you. And we've certainly seen that with COVID and how quickly it spread all over the world. So we should absolutely care about what's happening in other countries. And the way that we should think about it is if our neighbors do not have what they need to prevent and treat disease, then it puts everyone at greater risk. And the opposite is also true. When everyone can access healthcare, we are all better able to combat disease. And so I always like to start these presentations talking about the Sustainable Development Goals. And Healthy People 2030 really focuses on increasing disease monitoring and prevention efforts. So, really thinking about how we can improve global capacity to prevent, detect, and respond to public health threats. So, why even bother get involved in global health? Well, creating good global health really benefits society locally and globally. Improving global health can also lead to incredible economic growth, and it also allows us to learn about other cultures. The United States is a melting pot. There are people here from all over the world. So, global health can also be local health. So, experiencing this global work really does help us to learn about other cultures. And as I mentioned earlier, my very first experience as a nurse practitioner was on a medical mission where all I had was my skill set, my knowledge, my translator, my stethoscope, and I was able to provide care without all of the fancy tests and technology that we often take for granted here in the United States. So, as that first experience as a nurse practitioner in another country where I didn't speak the language, it really did help to expand my skill set. And I believe really truly helped me to be a better critical thinker. And so, one of the other biggest benefits of being involved in global health is really having a better capacity for understanding the needs of the patients that you are treating, whether you're treating them in the country where they come from or you're treating them here in the United States or wherever you may be. This does not come without challenges. There are many challenges associated to participating or planning global health missions. The biggest one being finances. So, as an individual, being able to go on global missions, do global work can be very costly. And if we think about the non governmental organizations, the NGOs, they also have to raise a lot of money to be able to support their mission work. And we have some organizations who are going on missions annually and some who have much more presence in host countries. So it takes a lot of money to be able to pull this together. In other countries, there might be limited resources, limited infrastructure, even limited internet access, which can make things rather difficult. Not to mention the language barriers and the cultural issues that you can encounter. So, today I am going to talk to you about my work in Nigeria. And so, Nigeria is Africa's most populous country with about 206 million people. It is in West Africa. It has one of the fastest growing populations globally, with about 5.5 live births per woman and a population growth rate at about 3.2% annually. So it's estimated that the population will reach 440 million people by 2050. It has a diaspora spanning the globe with over 370 ethnic groups and languages. Nigeria's gross domestic product is the largest in Africa. However, its per capita income is low, with a highly inequitable distribution of income, wealth, and therefore health. So it's really a picture of poverty amidst plenty. Nigeria is both a wealthy country and a very poor one for this reason. About 40% of Nigerians live in poverty in social conditions that create ill health. And so there's ever present risk of catastrophic expenditures from high out of pocket spending for health. Even when you compare it to countries of similar income levels, in Africa, Nigeria's population health outcomes are poor, with national statistics masking drastic differences between rich and poor, urban and rural populations, and different regions. Some of the major obstacles include ineffective use of available resources, a dearth of robust population level health and mortality data, insufficient financing for health and healthcare, suboptimal deployment of available health funding to purchase health services, and large population inequities. So while Nigeria has a very young population, it's spending more on health than many countries in West Africa. Mostly it's out of pocket expenses. Nigerians have a lower life expectancy of 54 years than many of its neighbors, and their lower life expectancy is partially due to having more deaths in children of 5 years and younger than any other country in the world, including more populous India and China and countries experiencing widespread long term conflict, such as Somalia. So, chronic diseases and a high infectious disease burden and an ever present risk of epidemics of Lassa fever, meningitis, and cholera really do present additional challenges. A rising population and inadequate infrastructure development over the past 30 years have contributed to increasing deaths from trauma through road injuries and conflicts driven by inequitable distribution of resources. So, addressing Nigeria's health challenges really does require a whole of government and whole of society approach in order to prevent poor health. So, this means investing in highly cost effective health promoting policies and interventions, which have extremely high cost benefit ratios and really offering clear political benefits for implementation. So, those interventions are needed to improve child nutrition, reduce indoor and outdoor air pollution. So, referring back to those sustainable development goals, address unmet family planning needs, and improve access to safe drinking water and sanitation. Nigeria has a pluralistic healthcare system with public and private health providers with both modern and traditional healthcare system. The federal government is responsible for tertiary healthcare and also formulates health policies through the Federal Ministry of Health. So, this level also provides specialized services through the teaching hospitals, federal medical centers, specialist hospitals, and medical research institutes, in addition to tertiary healthcare provision. The state governments provide largely secondary health care through the state general hospitals and occasionally tertiary care through the state owned teaching hospitals. They also coordinate primary health care implementation at the local government area level through the state primary health care development agency. And then you have the local government areas that also manage ward health committees, village health committees, private healthcare providers, and traditional and alternative healthcare providers that enhance service delivery and community mobilization. So, just a little bit of a breakdown of the healthcare system in Nigeria. I think it'll help us to put a little bit more scope to what we'll talk about in some of the work that I've done in Nigeria. The country has the second largest number of people living with HIV globally, and it still has the highest burden of malaria globally, which remains the top cause of child illness and death. The Nigerian government has previously implemented policies to achieve universal health coverage. However, only a few are actually insured. In 2022, the President of the Federal Republic of Nigeria passed the bill for the National Health Insurance Act. And as a result of this development and the ensuing target of providing health insurance to all Nigerians by 2030, efforts to combat the high prevalence of poverty caused by out of pocket medical expenses while engaging with the state health insurance agencies are now more feasible than ever. So there is a process for health insurance, but as you can see, there's not a lot of coverage within the community, and there's the concern about paying out of pocket costs. But there is some good news. I'm happy to report as of March 15, 2024, the Nigerian government approved the introduction of advanced nurse practitioners to the nursing profession. And so the role of advanced practice nurses in Nigeria is still pretty much in its infancy. Previously, the only two roles that were recognized were the nurse anesthetist and nurse midwives. So the goal is really to improve access to quality healthcare, and we've seen nurse practitioners do this in the United States, and also expand the scope of nursing practice. However, advanced practice nursing is still a relatively new field in Nigeria and is underutilized. So some say that advanced practice nurses could really help to fill the doctor shortage. While Nigeria has a lot of physicians, their physician to patient ratio is about 4 to 10,000. So the absence of physicians in primary care, just as we have in the United States, is an opportunity for nurse practitioners. And so increasing numbers of patients with different health needs already impose compelling circumstances on the nurses and the midwives to perform advanced duties. So the introduction of nurse practitioners in Nigeria is a great advancement. But for us to be successful, for Nigeria to be successful with nurse practitioners, nursing curriculum in Nigeria must change. Advanced practice roles are extremely limited, and expanding the curriculum and offering training for current nurses to advance their careers is a place to begin. Secondly, I think Nigeria will have to develop innovative ways to really draw individuals into the field of nursing and retain them. So, I want to move on to start to talk about some of the work that I have been able to do in Nigeria. I work with an organization called the Nigerian Healthcare Foundation, which was founded in 1995 to really address some of the healthcare concerns in rural Nigeria, where access to basics such as healthcare, education, proper hygiene is really limited or severely restricted. So here is a picture of our 2022 team. We embarked on this medical mission in July, and really the goal was to drastically improve health conditions and social welfare in Nigeria by providing medical care. So the organization was founded by Dr. Obilo, who is standing right next to me in this photo. He is a pediatrician based out in New Jersey, and he is from this rural village called Oweri, and started doing this work more than 20 years ago to really give his community access to healthcare. So we are focusing on rural communities that really do lack accessibility and affordability to ongoing primary care. So here is a photo of our 2023 mission team. It comprised of course, Dr. Rubilo, his wife, in addition to myself and colleague and partner in crime, Dr. Sandy Kao, who works out of Yale. We do a lot of global work together. One of the things that we were really excited about with our 2023 trip, that we were able to take a nursing student, Naomi Gibson, who graduated from Malloy in December and is now a registered nurse at Columbia University Hospital. We have Charles Joyner, at the time was a FNP student at Long Island University, which also happens to be my alma mater. He has since graduated and is working as a nurse practitioner. And then we also have Julian Muhammad, who was one of my students at NYU, who has since graduated and has been working at a hospital in the emergency department in North Carolina. So I've been able to work with this organization for 2 years and currently serve as its medical director. Here is a photo of the rest of our team. And so it was important for us to not only bring healthcare professionals and healthcare professional students from the US, but to also partner with the nurses and other healthcare professionals in Nigeria. It's important to have these sorts of relationships in order to have sustainability of the work that you're doing. And so we have people on the ground that even when we're not there, they're doing the great work. And so we partner with nurses in the community, the nurses in Nigeria, just like other countries such as Ghana. The community really relies heavily on community health nurses. So we were happy to be able to partner with the community health nurses as well as physicians and pharmacists in Nigeria to put this mission together. Each time when we are on our mission in Nigeria, we stay for about 10 days to 2 weeks, and it's a process. So once we end the mission, we're preparing for the next one. So this one really involves raising a lot of money. We had a fundraising gala. We had lots of donations. We reached out to drug companies. We were able to secure lots of supplies, lots of medication so that we can provide this free healthcare to those individuals in Nigeria. So it ended up being a very successful mission both years, and I'm happy that I'm able to share some of my stories with you here today. I want to talk about my student experiences. One of the things that's important to me is really being able to include students in global health. It's not usually an experience that they have access to in nursing school. So I really do make it my mission when I'm doing this global work to incorporate as many students as possible. So this is a photo of our 2022 team. We have Charles and Naomi, who were nursing students. In addition, next to me, you see two other nursing students from NYU. They actually graduated in May of 2022 and took their NCLEX examination the day that we left for Nigeria. So we were actually with them 2 days later when they found out that they passed. And so I try as much as possible to incorporate my students in the global work that I'm doing because I truly do believe that the true healthcare, the impact really takes place in the community. While we spend a lot of time training our students to prepare to give care in the hospital, at that point it's too late. We want our students to be well versed in what it takes to prevent patients from going into the hospital. And I think a big way to do that is immersing them in global health. And so I make that one of my missions. So in total, during the 2022 mission, we had 4 students with us, and I'm happy to say that they are all actively practicing in their respective fields, and I'm really proud of them. I'm really happy to stay connected with them. So I want to talk to you a little bit about what our plan was in going to our medical mission in Nigeria. And I say our plan because one of the things that I learned rather quickly when dealing with global work and planning medical missions is that nothing ever goes according to plan. So, as I mentioned earlier, Dr. Obilo has been doing this work for about 20 years. We went to his hometown where he grew up, a rural village in Owerri, where he also has a home that he built. Because he's been doing this work for so long, he has strong ties in the community, which is very important. You have to have those community relationships. He is also a chief in the village, so he is very well respected. Because he had been doing this work for so long, he actually built a clinic, which was in walking distance from where we stayed at his home. So, in the beginning of our trip, we flew into Lagos, which is a big city in Nigeria. I sort of equate it to the Times Square. It's the Times Square of Nigeria. We spent some time there. We were able to explore and be tourists before flying to the village. However, in 2022, as we landed in Nigeria, it was also the time of their election. And with their election, there was a lot of political unrest. Nigeria sort of gets a bad rap for being unsafe. I didn't find that to be my experience, but at that time they were experiencing an election and there was some political unrest. Unfortunately, there was a car bombing near the area where we were supposed to go in Owerri, which delayed our trip. So, again, nothing went according to plan. We ended up having to go to the village a few days later. And unfortunately, because it was election season, because it was the car bombing, we could not work out of the clinic that had actually been built for us. So, what we had to do was work out of the home that we were staying in. So these are some photos of us in the living room. We set up the living room as our pharmacy and categorized all of the medications in different areas of the living room. So as you can see, there's lots of pill bottles on the couch. And this is how we ran our mission. So we had the living room set up as our pharmacy. We had another small room that we were able to see patients in, and then we had the patients waiting outside of the small room that we were staying close to. So, unfortunately, during this mission, we were not able to work in the clinic that was close by. But I'm happy to say that we were able to do so for our 2023 mission. Again, we collaborated with the Nigerian healthcare professionals and had an entire team that was able to provide treatment based on the resources that we were able to secure before we coming to Nigeria. So we had all types of medications to be able to manage some common chronic diseases like hypertension and diabetes. One of the other things that you see when doing a lot of global work, you see a lot of skin infections, you see a lot of wounds. So you had supplies to address those needs as well. One of the common complaints for individuals in the community is back pain, but they term it as waist pain when you're seeing them. And so we had a lot of medications that we could utilize to treat pain. We also had nutritional supplements for children and were able to deal with upper respiratory infections and eye infections, but we did see a lot of skin infections. So we had tons of medical supplies that we were able to utilize, as well as medications that we could provide to the individuals who came to see us. So it really was an amazing experience, not just for me, but also to see the light go off for those students who were able to recognize the importance of community health and recognize the importance of global health and really do their part to strengthen a community. So I am an adult nurse practitioner, but one of the things that I love when doing this work is all of the babies that I get to see and care for and play with. So it really was an amazing experience. We saw a baby, I think that was the youngest baby in this picture here at the bottom, who was about 1 month old, all the way to older adults. I think our oldest patient was 95. So again, common diseases that we were assessing and treating: hypertension, diabetes, pain, nutritional deficiency, wounds, skin infections were some of the things that we were fully equipped to care for while in Nigeria. So for the 2022 mission, we ran our clinic outside of the house for about 5 days. Again, we were delayed because we had to stay in Lagos a little bit longer due to the political unrest. So in 2022, we saw about 750 patients over that 5 day period. However, when we did go back in 2023, we were able to work out of the clinic that was built for us, and we were able to see about 1,250 patients over a 4 day period. So, global work really involves long days, long hours. It's hard work. It's not glamorous, but I will tell you that it is the most rewarding experience. I've been a nurse for almost 20 years, and nothing brings me more joy than to be able to go into another country and provide care to individuals who might not have gotten that care if you weren't there. So we truly take a team approach, really involving the local health professionals as well as the individuals that we bring along with us, and really securing a solid team. And I think that the nurses and the other healthcare professionals really do benefit because they can learn from us, but we can also learn from them. And so it's mutually beneficial. We work with the nurses to assess their skills, but also to teach them new skills so that we're able to collaborate and run our clinics very efficiently and effectively. I wouldn't do a good job if I didn't discuss some of our success stories. So, this is one of the individuals who we actually saw on day one of our medical mission. 24-year-old male, and he came in with a left lower extremity wound. It was really infected. It was on the inner aspect of his shin towards his calf and also spread to the dorsal part of his foot. So he came in to see us on day one, and I was really proud of my nurse practitioner student, Charles Joyner, who quickly assessed him and jumped into action. And he was able to debride the wound. We had wound care supplies, so he was able to debride the wound as well as dress the wound, provide the individual with a change of dressing so that he can change it every day. And we also had a lot of antibiotics with us. And so we were able to provide him with antibiotics as well. We had him come back on our very last day of this 2022 mission, and his wound was much improved. We actually also saw him in 2023. He still did have the wound, it had gotten better, but we had to start to think about what are some things that we can do to help him care for this wound while we're not there. We gave him more antibiotics, and we talked to him about using honey. And so, if you weren't aware, honey is a great antibacterial. And so, thinking about ways that we could address this wound and provide some prolonged care, and it was really beneficial to him. Another success story that I want to share with you is about this family. And so you can see I'm holding the youngest of the 7 children. So, as I mentioned, Dr. Obilo is very highly regarded in Nigeria. He is a chief. And so we actually have some video recording of this conversation. What you see are us standing in the room where we were seeing patients in. Very small room, had a bathroom, 3 couches, and each provider had their own couch where they were able to assess and treat patients. So we would bring them in, do their vital signs, get a history, do a physical, make our diagnosis, and then we were able to treat them, whether we gave them IM antibiotics. We also had IM B12 shots that we were able to give, and a host of medications that we could leave them with. So this family was very unique. Dr. Obilo is highly respected in this community, and the couple came to see him several years before and said to him that they had trouble having children. So he met with them, he prayed with them, he blessed them, and lo and behold, they now have this extended family. And so it was so wonderful to be able to watch them share this story and just hear how they felt so blessed by the work that Dr. Obilo and his team has been able to do in Nigeria. And because of his work, they now have this wonderful family. So I just wanted to share that great story with you. I also wanted you to be able to hear from some of our volunteers. So this is Naomi again. She was a student that graduated from Malloy and is now working as a registered nurse. She's also one of my mentees. She's been on both of the trips to Nigeria. And what she had to say was that NHF has afforded her the opportunity to pour into the lives of others while building her nursing skills and cultural competency. And she really does feel like she has been a blessing for this community, and she certainly has. We also have a nurse practitioner, Jennifer Rose Ellison, who was also an FMP student while participating in this mission, really able to see the benefit of doing this global work and really expressed her gratitude for NHF. Now, while I think it's great to hear me talk about this mission, I do want to give you the opportunity to hear from our team to let them tell you about their experience and how much it meant to them. So I'm just going to play a quick video for you.
Since 1995, we've been taking medical mission to Nigeria and taking care of communities that have been neglected due to poor health care.
Take this once a night for your high blood pressure, okay? You take this for your cough at night.
We had the opportunity to be in Nigeria this year. This is the 19th year of our operation as a medical mission.
My name is Zina Salem, and I've been here in Nigeria now for almost 2 weeks on a medical mission. And honestly, the experience has been amazing. It's been surreal. I've always wanted to partake in a medical mission, and after I got this opportunity, I decided that this was something that I really wanted to do.
In the past 2 years, we have had a lot of issues because of the pandemic. And as a result, we did not go back to help those in need. And there were a lot of human toll. A lot of people lost their lives, as is the pandemic was a global issue that impacted the world in general. More especially the countries that have been already marginalized, like Nigeria.
So being a new registered nurse, I definitely had to develop my clinical skills a lot quickly. We've seen hundreds of patients every day that dealt with a whole lot of various conditions, from diabetes to hypertension to various forms of infections, and a lot of patients dealt with pain all over their body. So just working with these people and trying to give them the care that they need was definitely beneficial for me as a clinician and to grow my skills.
As I come on Monday, so now they attack me immediately without any delaying. Now they then come they treat the thing. I can't feel, they can't took me injection, I can't they feel pains. After some times, now the pains come release.
Once we arrived, immediately I began to feel emotional about this experience. And then after the emotions begin to sort of settle in, you begin to focus on the job that we have to do, which is to care for people. One in which was a young man who had a bad bacterial infection which had grown throughout his foot and had caused several ulcers throughout his foot. And he's had this since 2019, and it had gone untreated. We cared for him, we treated his wound, We dressed his wound, we cleansed his wound, we debrided his wound. And I have to say, I have never seen a wound that bad.
I've gone on trips for a week's time, but being immersed in a culture and being able to give back the way that we have has just really shifted my mindset on nursing, on humanity, on healthcare, and I've really enjoyed it.
My purpose of coming here is to come and take drugs for waist pain and headache.
I am really passionate about global health. I believe that what happens in other countries affects the entire world, and so we all have to do our part to take care of the health of our community. This is actually my 6th medical mission. I have been to Ghana, I have also been to Haiti, but this is my first time in Nigeria. It really has been such an amazing experience here with NHF and Dr. Obilo and the entire team.
We used a center that is not our own yet, because we're working to make sure we have a place that will have a continuity of care. And this is one of our vision, to have a center.
When you look into their eyes, you see your children. When you look into their eyes, you see your mother, you see your grandmother, and you would not want to see your loved ones in those conditions.
We've seen some patients come in who've had really bad wounds, and we help to dress those wounds and to make them better. And to see them come back a few days later, so appreciative and so grateful and so happy to have us here.
So then don't remove the medicine where they put before, come put new one now. So the face can't change than before. So I don't feel normal, small now. So I thank God.
I thank each and every one that has helped us over the years. All my wish is for God to continue to bless each and every one that has helped us to make this organization functional. Thank you so much.
So this is just a glimpse into our 2022 mission. One of the other things that I didn't mention is that Dr. Obilo's wife, who is a New Jersey school teacher, actually cooked and made meals for all of the people in the village every day. So not only were we providing health care, but we were also providing nutritious meals. We did bring some supplies with us. So one of the things that I love is to be able to spend time with children. So we brought some supplies for the kids, some toys, coloring books, and we would do activities with them. And one of the things that I learned quickly is that they really love to take Snapchat photos. So these are just a few pictures of some of the fun that we were having with the kids in the village. So it's not all work. We do get to have a little bit of fun. Another thing that we did do was we had a photo shoot in the village. So here you see myself with Naomi and Zena having a little bit of fun, taking some wonderful pictures in the village as well. And so thank you so much for allowing me to share my experience with you regarding my 2022 and 2023 mission to Nigeria. People always ask, what are some things that they can do to get involved? And so if this is truly something that you're passionate about, something that you'd like to get involved in, I would recommend that you always do some self-reflection. Think about, what are my motivations for being involved in global health? For me, it was very personal. Like I mentioned earlier, my father is from Haiti. He actually is retired and lives there now in his home that he built. And my very first mission was the year that Haiti had their earthquake. So for me, it was very personal. I was giving back to my community, taking care of my community after such a huge devastation. And I loved it so much that I kept going back. So you always have to think about what your motivations are for doing global work, because this is hard work. It's not easy, it's not glamorous. A lot of the times we're in places where there may not be electricity, there may not be running water, there may not be internet access. You're away from your family for long periods of time. It's hard work. So you always have to think about your why and remember your why on those days when it gets a little tough. Start learning, do your research. There's lots of non-governmental organizations or NGOs that are doing work in various countries. So start doing your research and identifying some organizations that their mission and vision align with yours. You can also get involved locally. Global health is also local. We have places in the United States where healthcare isn't so great. And so you can get involved locally. It doesn't always involve going to another country. Always be on the lookout for opportunities that may arise. Always keep up with global health issues. Again, what's happening in other parts of the world is absolutely important to us. It's going to impact us. And maybe you might want to consider full-time work in global health. So those are some of the things that you can do to really be beneficial to other communities in other countries. I want to take this time to thank the Nigerian Healthcare Foundation. This is how you can contact us. I want to dedicate this presentation in loving memory of Arthur. Arthur is Dr. Below's son-in-law. That's his wife, EJ there, Dr. Below's daughter. And unfortunately, we lost Arthur a few weeks ago due to colon cancer. So I wanted to dedicate this presentation in the loving memory of Arthur. So here's our contact information if you're interested in learning more about the Nigerian Healthcare Foundation. Thank you so much again, April, for having me. If you want to stay connected, this is how you can reach me. I look forward to hearing from you. Happy to chat about all things global. But thank you so much for your time and being here today to talk about nursing in Nigeria.
Wow, thank you so much, Selena. That was absolutely beautiful. What a remarkable story. And just thank you for sharing your journey. And I go back to the beginning where everyone asks, how do you do all these things? And it just, it all comes together that you are doing all these things, but that it brings joy. And you could really see that in the photos and in sharing the experience. So thank you. I do want to offer some time for participants. If anyone has any questions or comments for Dr. Gillis.
I was wondering if you saw an opportunity to, rather than just treating the patients at the clinic, maybe getting some nursing students from locally out there to start, advancing their skills as well. Do you guys ever see yourself kind of breaking off and doing some teaching while you're there?
Oh, absolutely. So in addition to the nursing professionals that we had with us, we did have some local nursing students and local medical students. So we would put them in the triage area. They will also shadow the healthcare provider. So it was really a learning opportunity for them. We did bring a lot of medications with us. Now that we have this clinic and those nurses actually live in the community, they can still provide care to the community when we're not there. So we not only left them medications, but we also left them other supplies like BP cuffs and thermometers and wound care materials, so that while we're not there doing the mission work, they can still continue with this great work. That was something that was very important to us, because you find with a lot of the NGOs, yes, the work is getting done while you're there, but what happens when you're not? So it's always thinking about sustainability.
Any other comments or questions? I'm not really paying much. We've got a lot of thank yous in the chat. I'm gonna link. I don't think there's any questions. So funding. go on on the health mission trips. How did that come about? Because that's always, as you mentioned before, finances is always a big piece of it.
Mhm. So the financial resource is certainly one of the biggest challenges, and might I even say barriers to doing this work. So you have to think about your own financial situation. Can you afford to purchase a $3,000 flight so that you can get to Africa and do this work? It involves you taking off time from work. Maybe you have to use your vacation time to do this work. Not to mention paying for hotels. Where are you going to stay? Providing the organization with money so that they can also house you. There are certain things that you have to do in preparation for mission trips, including getting vaccinations like yellow fever, hepatitis, typhoid, polio. All of that is a cost as well when you're thinking about your own motivations and what it will require for you financially to participate in this. But in looking at the organization, to hold a 10-day mission is very expensive. The individuals that we are treating are not paying for this care. And so we are coming as a group to provide care. We're bringing medications with us. Most of the time, those medications are donated, but in other instances, we have to purchase those medications from a wholesaler or directly from the drug company. So we have to do a lot of fundraising. So individually, all of the volunteers have their own fundraising links that they can share in their networks to raise money. With this particular organization, we also have a fundraising gala where people can donate money, but it does take at least $50,000 to $75,000 to put on a 10-day mission. Unfortunately, we weren't able to have a mission this year because of what was happening with Arthur, and we also didn't have the funding. But Dr. Obilo did go on his own to do what he can within his community. But it does take a lot of financial resources. So fundraising, word of mouth, we have our social media, which we use to advertise all of the things that we're doing. But the volunteers, they're not getting paid. They're paying their way to participate in this mission. And I always say, if you ever get the opportunity to do global work, please take advantage of it. There is nothing more rewarding than being able to see the smiles on the faces of the people, especially the children that you are able to help. And they're so grateful. And I think it gives you a true appreciation for your own life and the things that you have and the things that you take for granted. Because when you go into some of these areas, people have little to nothing, but they're so happy. And so you leave with a sense of humility. Well, what do I have to complain about? How is my life so bad? And just really makes you appreciate the things that you have, but also makes you want to do this work more and more. So I'm always talking about global health to anybody who will listen, and anyone who wants to come. If you have the opportunity to do this, please, please take advantage. You never realize the people you're helping, not just the people that you are caring for, but also the people you are inspiring to become a healthcare professional because of the work that you've done.
Totally agree. And for all that are still on, please pass along the information on how to get involved. I just think it's such a wonderful program and does so much good for so many. So thank you all. Are there any, the chat's just rolling with lots of thank yous and our just deep appreciation for you sharing your story with us today. It's so moving and has made such an impact and continues to make an impact. And thank you. Thank you for bringing along students and teaching the next generation to do the same. And just thank you for just such a wonderful example of all that a nurse practitioner can do. Just the impact of one nurse practitioner. You've just made such a tremendous impact. So for everyone, before you sign off, please know that there's continuing education for this course today. I did put in the chat. If you'll scroll back up to the top, there's a link. I'll also send it out in a post session email. If you fill out that evaluation, then you would get a continuing education certificate emailed to you after. And please continue to join. If any of our colleagues were not able to join today, many do pick up and watch the recording afterwards. It can be found at our alumni site, and we'll send that information out in the post-session email as well. And please join us in September for our Global Collaborative. It will be, the date is, let me just double check and make sure I've got the date right. The date is September 18th. And we'll be joined by Dr. Karen Moore and Daniela Lewalt, both who are on the core steering committee for the International Council of Nurses NP-APN network. And they're going to talk more about what the International Council of Nurses does, but also specifically what the network does to advance practice nursing and nurse practitioner roles around the world. Thank you all for joining. Thank you so much, Dr. Selena Gillis, for being with us today and sharing your story. It was so powerful and so moving, and great words, very wise words for us all to take with us. Thank you.
Thank you.
Thank you.